We just gonna get into it. In today's video, we are going to be talking about 5 common mistakes that I have seen mental health providers do when they are billing for their sessions. These mistakes can delay payments, they can make your revenue unpredictable, they can even result in some non payments, especially if you are waiting for insurance company to respond back before you charge your patients their deductible or their co-insurance. So we're going to get into it. The list is going to go from the least problem to the most common problem. So the least common to the most common problem. So number one, the first common billing mistakes that I have seen mental health providers make is coding their sessions incorrectly. Now, there are some mental health providers that I have seen and I have educated that still want to bill or trying to figure out how to bill like for a session longer than 60 minutes. And there are also new procedures or techniques that providers want to introduce in their practice. Not quite sure as to how to bill them. So they will select the bills, but don't have the sufficient documentation to kind of back up the CPT code that they're billing. Like, say, for instance, if they're doing like a cognitive questionnaire or assessment, or if they're doing some kind of testing, a lot of times they will just document and you providers, mental health providers, will just document that the testing was performed and the outcome, but not necessarily the details of the testing. And I understand that because a lot of notes that in our scope of practice that we deal with are on a need to know basis. So a lot of times providers do not like to be very detailed in some of these notes, but especially with those testments and assessments, those notes do need to be detailed because a lot of times if they are questioned, um, we need to be able to have access to those notes as your biller in order to quickly get a response back to the insurance company and to quickly get revenue released for the services that you provide. So one of the things, like I say, is just coding incorrectly. So just double check your codes. Just know that unfortunately at this time, at the time of this recording, we do not have any solutions to bill for sessions over 60 minutes. A lot of times we will suggest that you break up the sessions or have your scheduler just to make sure that the sessions are scheduled for no more than 60 minutes. And it absolutely depends on your payer. As to the most they will pay for is a 45-minute session. So it depends on your contract, it depends on your payer, it depends on your area. Just make sure that you understand your contract with the payer and the plan that your patient has. Okay, let's get into number two. So, the second most common mistake that mental health providers make when billing for their services would be documenting. So, documentation is so important in our world. There is this cliche, if it's not documented, it's not done. I halfway believe in that cliche. Like, if I can tell as the coder that there was something that was performed and the provider just, didn't document well enough or didn't document in a way that would make sense in case an insurance company requests medical records, I will send a query to ask the provider in a way that will like kind of nudge and remind the provider, oh, you did something more here that should be documented. I don't lead the provider, but I will ask yes or no questions or open ended questions. And there is an art to the inquiry. So, but if you don't document things like time in and time out, a lot of providers would like to document the total time for the sessions, but really best practice would be to document the time the session started and the time the session ended. One of the most common things that I see with documentation, especially in our field, is because we do a lot of telehealth visits, is that the doctor or the therapist will not attest to the telehealth visit. You have to attest that the patient gave you consent. You have to also document where you're located, where the patient is located. That's very important so that we can pick the correct place of service. You also will have to document that you have seen the patient via audio and video conference or just audio conference. So we need that telehealth attestation documented in the notes. But so important, the date of service, of course, the time that you spent with the patient, a time in, a time out, a plan of treatment, the outcome of the treatment. Is the patient responding well to the treatment? Are there any changes done in the treatment? Just something like that. And of course, stuff to support the medical necessity of the visit. So that's number two. All right. So number three, the third common mistake that I see some mental health providers make when billing for their services would be demographics, failing to have the demographics loaded into their EHR properly. So sometimes especially with private practice providers, some of the EHRs leave it up to the patient to type in their demographics. A lot of time patients are very casual. And when they type in their demographics, they will maybe type in a name that they prefer to be called by, or they will type in their current address but didn't update their address with the insurance company, or they will forget their surname, like their junior or the third, or sometimes their insurance card will have their middle name and they won't type it in. Little stuff like that, believe it or not, can lead to denials in the claim because what they have on the claim does not match what the insurance company has on file. And especially if you have an EHR that allows the patient to type in their own demographics and that information directly transfers over to the claim. It's really, really important to have your biller to verify that the patient information and demographics is incorrect, either your biller or your scheduler. But either way, you need to make sure that the demographics is up to date and is matching what the insurance company has. If your insurance provider uses Availity or some sort of provider portal, that's probably the best way that you can make sure that it matches. Look in Availity or the provider portal, look in your EHR and see if the first name matches, the middle initial matches, or the middle name matches, the last name matches, the address, who is the policy holder, all that stuff needs to match. So make sure that is done properly. Take the extra step to pull up a provider portal or Availity and just fact check it against what is in your EHR. Okay. So that was number three, demographics. Yeah, the fourth common mistake that mental health providers make when billing their services is just failing to, update themselves or to follow up on denials. Denials is inevitable. Like denials is one of those things that all practices get. We can't avoid denials. You never know what you would get denials from. Like I stated before, it could be for an incorrect coding error. It could be for they requested medical records and they feel like the documentation doesn't match the code that you picked. It could be for the demographics not matching what the insurance company have on file. It can be for anything. It can be for the insurance company just, don't have some information on the back end correctly. Whatever the reason is for the denials, is really important that you follow up on the denials as soon as possible, because despite what a lot of people think that, oh, once a claim get denied, it's really hard to have them to overturn it. It's extra work, but it's not hard to get them to overturn it. It takes a phone call, it takes some investigation, it takes a lot of that stuff. But once you have all your ducks in a row, your T's crossed and your I's dotted, and you sure that the claim is clean, you should be able to get that denial overwritten just with a phone call. Sometimes you do have to go the extra step and appeal, but in whatever case it is, you need to follow up on a denial. You need to also know any patterns in denials. Is something constantly getting denied? Is like a certain insurance company denying the same thing? Is it particular to a patient? Is it particular to, a CPT code? Try to figure out what the pattern is so you can get to the root cause of denials so that you can kind of like nip it in the bud. So that's the fourth most common mistake that I see mental health providers make. And that's just not following up on denials or not fighting for that revenue. They think that it's just a lost cause, and it's not. It could be something so simple that could be fixed over the phone to something that's a little bit more complex that does require an appeal. But even then, appeals are still worth fighting for. So, if you have enjoyed this five most common billing mistakes that I have seen mental health providers make so far, why don't you consider giving this video a like and sharing it with a mental health provider that you want to help out on their billing journey? Also, if you haven't done so already, please subscribe to the channel. I appreciate the support. And if you have any questions, list them below. I'm about to get to the last common mistake, and it's a big one. It's the one that's the most common. And I bet y'all probably can already guess it. If you can guess the most common mistake that mental health providers make before I even name it, put it in the comments real quick. And while you're doing that, I just want to take a quick moment to tell you about the billing services that I provide. So, my company is called Superior Medical Consulting. We provide full service mental health billing services for therapists and mental health professionals. I will put our phone number on the screen here, and I will also link the website in the description box below. You can schedule a free consultation today. Anyway, let's get into this fifth most common billing mistakes that mental health providers make. You probably guessed it. It's verification of benefits. It's very, very, very similar to the demographic most common mistake, but verification of benefits is more than just demographics. It's verifying that the patient is even active, that the patient coverage is even active. They still, a part of the plan, that they have mental health coverage. You have to make sure that your codes that you are planning to bill for or do not need an authorization or do not need a referral. And if they do, you need to get that authorization and get that referral. You need to make sure that the patient has telehealth services. If you are performing telehealth, you have to just make sure that you are submitting to the correct insurance payer. Because some they have carve out carve out benefits. It's just a lot of craziness that can go on if you don't verify. I would suggest that you verify benefits prior to each visit because you never know when a patient either changes plans or lose their plan. You never know when that happens. A lot of patients are upfront and very, very, very honest about, look, I don't have coverage anymore, but some patients are not. So in order for you to make sure that you are not losing out on your revenue, I would suggest that you verify insurance before every visit. You probably need once or twice a year to do a full, thorough verification, like just have your biller to call to verify, make sure it's active, make sure they got mental health benefits, as part of their medical coverage, make sure that you don't need any pre-authorization, make sure you're in network, all that stuff. Maybe once or twice a year you need to do that, and then before every visit, if your EHR is capable of doing a quick eligibility just to see if they're still active, and then make sure you do that or go into availability and do it real quick before their session. Those are the five common mistakes that I have found that some mental health providers do make when billing their session. If you make sure that you have these five, pretty much intact, create some kind of checklist, have a biller that's well versed in understanding these mistakes and how to avoid them, then your revenue should be a little bit more predictable and you should be able to rely on this revenue coming into your practice, fairly consistently. Understand these five common mistakes. Make sure that your practice aren't, falling victim to any of these mistakes. And if you do, just create a plan to remedy these mistakes and to make the billing transition a lot better. Again, If you have enjoyed this video, thank you for subscribing. Thank you for liking the video. Thank you for sharing. I'll leave all my contact information in the description box, and I will see you in the next video.